Hello, everyone. Thanks so much for joining us today. We are going to be talking about 5 critical steps to ensure success with telemedicine. It looks like we still have quite a number of people joining us. We had a lot of people register for today's event. So hopefully, as I go through some housekeeping items, that will give people a chance to get logged in. And by the time we actually get started with our content, everyone will be on. My name is Leah Chatham, and I am the Director of Content Marketing here at Solution Reach. I have been providing education for providers, staff, and patients for over 20 years, working for leading EHR and practice management companies, patient engagement companies, and also for about 5 years for a small integrated health system. So I do have quite a bit of experience on both sides of the aisle, so to speak, and hopefully I'll be able to bring some good insights today to help you all with this transition to using telemedicine or hybrid care as we all deal with the COVID-19 pandemic. As I mentioned, we do have a couple of housekeeping items that I want to cover. The first one is that I would encourage everyone to consider connecting with us on social media. It's a great way to stay up to date on sort of the different events and information that are being released by Solution Reach. So webinars like this one, or informational content about how to use different tools or be successful in patient engagement, practice marketing, things like that. It's also a good way just to stay up on what's happening in the industry. We do share a lot of content coming from other thought leaders and industry groups. So please do connect with us. You're also welcome to connect with me at Leah Chatham on Twitter and on LinkedIn. I'm always happy to connect with folks and answer questions. If you do have support-related questions, we would encourage you to go to community.solutionreach.com. I know we've got both customers and non-customers on here. This isn't the best place to get support-related questions answered. So go to the community, click on my support, chat with us online, give us a call. It's got a great resource of knowledge-based articles in there. A lot of times you can just get your questions answered by typing them into the knowledge-based search bar. So something to consider as well. Questions. We do want you to ask questions as we're going along today, and I will do my best to answer them at the end or to get you an answer later. So please do enter those questions as we are going. A couple of common questions that we do tend to get quite a bit. One is that you will get the slides and the recording later today, so watch for that, or tomorrow, watch for that via email. Also, we often get questions from people who might be having trouble with their audio. If you're using your computer audio, that often is the cause of the problem. So go to the audio option on your toolbar, click the little arrow, and change from computer to phone. And that should resolve any issues that you are having with your audio. So again, yes, you will get the recording at the end or later in the slides. And if you're having problems with your audio, please switch from computer to phone. Let's see. You can also download the slides in the handouts today. We have a sort of a comprehensive guide that includes a lot of the information that is in the webinar. So you can download that here today as well. Again, if you are having problems with the downloads, which sometimes people do for some reason in GoToWebinar, it's fine. We will be sending you the slides via email. So today's agenda, the 5 things that we are going to be talking about as far as what are the best practices and what do you need to be doing now, relate to how to select the right technology, how to set up the best workflow, how to get the most out of your implementation and training, how to create a great patient experience, and how to track your progress and measure success. So these are sort of the 5 key areas around having real success with telemedicine. And we are just going to take this opportunity to touch on what are the most important things in each of those areas. As I mentioned, we did also include our more detailed guide here. So if you download that, you'll get even more insights and suggestions beyond kind of the key things that we're going to be touching on today in the webinar. So you've probably seen, I would guess, given everything that's been going on, that telemedicine has really taken off as a way for organizations to try to deal with what's happening right now. And a good, or I think one of the best sort of data points that I have seen recently is this one that kind of compared from major payers the number of visits. And that is this change between pre-COVID and post-COVID, right? 2.4% of patients had used telehealth or had a telehealth visit prior to March. And since March, that has increased to 23% of patients among major payers. There have also been several studies asking patients about the quality of care, and the majority of patients feel like the quality of care is pretty comparable between telemedicine and in-person visits. And the majority of patients say that they're happy to use telemedicine. There's quite a bit of variation between how patients feel about it right now while we're in this period of dealing with this pandemic versus do they want to go back to some or all in-person visits, when this period is completely over. Definitely, it's a much larger number of people say they would really prefer to be using telemedicine right now. It goes down a little bit from about 88% to 66% in terms of all visits being telemedicine, but even 66% of patients saying they're happy to use telemedicine in normal circumstances is pretty high. Patients are frankly interested and happy to use it. Oh, sorry. Just accidentally knocked my mouse. So many of you probably have seen some definitions of telemedicine, but for those of you who haven't, I just want to make sure we kind of level set on exactly what we're talking about here. So telemedicine is often used as kind of the broader general term for all of the different types of visits that fall under this kind of remote or care at a distance category. Telehealth, generally, these, and we're kind of using these definitions based on how CMS approaches this and how they kind of define these from a billing perspective. So telehealth visits are real time, so synchronous, audio and video. So you're seeing and talking to the patient in real time. Telephone visits, obviously an encounter between the patient and the provider via phone, and really like a full encounter, not this other thing, which is called a virtual check-in, which is the 5 or 10 minute kind of brief check-in, which can be done over the phone or using a text message or doing some kind of back and forth using, text or email, this store and forward idea where maybe the patient is sending you videos or images. Those are to sort of determine if you need a telehealth or telephone visit. And then e-visits are asynchronous or not real time, but it is an exchange back and forth through some secure method like a portal or secure email. And then lastly, we have remote patient monitoring, which is using medical devices to monitor various parameters, and there's quite a number of things that fall under that, and we won't get into a ton of detail there, although we do have a recent blog post at srhealth.com on the blog that gives you quite a bit of detail, actually, on remote patient monitoring and some of the requirements there. And I'm going to apologize now for, you may have heard my dog bark, as most people are. I'm working from home, so I've tried to put her in a place where she'll be quiet, but I can't make any guarantees. So I hope you can all be patient and understanding if she barks once or twice in the background. Before we move forward, I did want to push out a quick poll just to help me understand how many of you are currently using telemedicine of some kind in your practice. Just to, if pretty much everybody is, that's helpful. If we're half and half, then that's helpful just so that I kind of know where everyone is in terms of their experience today before we kind of get into talking about some of these best practices. So I'm going to give everybody about 30 seconds. I'd like to get to at least 50 to 60% of us voting, because that'll give me a good idea of where we are, where everybody is. Okay, maybe 5 more seconds. Okay, great. So 30 seconds and we've surpassed 60% of you have voted. That's great. So it looks like about, and I'll share this with you guys. It looks like about 2/3 of you are currently using something in your practice and a third of you are not. And I am guessing that for those of you who are not, some of the common things that we hear really are related to things like concerns or fears around the complexity of the billing process for that, or the technology. So we'll try to address some of that. And again, if you have questions, put them in here as we go along and we'll try to answer them. Okay. So we're going to move on to our first topic, where we're going to be talking about selecting the right technology. And this is something that frankly has gotten a lot less complicated than it used to be. I think overall technology has become a lot simpler as we've moved to a lot of more cloud-based solutions or mobile-based solutions. There's a lot more flexibility now. It's a lot easier, both for providers and patients. But there are a few things definitely to keep in mind. So ease of use is obviously a big one. If you were trying to implement telehealth technology very quickly and push it out to your patients, it needs to be something that they can quickly get used to and use, right? And same with your providers. This is not a 6-month rollout. We are talking about implementing technology incredibly fast. We saw many customers, large facility type customers as well as small, trying to roll out telehealth to all patients in a matter of days or a couple of weeks when COVID first hit back in March. We've actually done several case studies where we've talked to people about how they did this, and most of them were rolling this out very, very fast. So as we look at what is coming over the next 6 to 12 months, it seems pretty clear that we are looking at peaks and valleys here. I think, especially for those of you who are in some of the areas being hardest hit right now, like Arizona, Texas, Florida, Southern California, you're probably concerned about the possibility of having to scale back again. What we're trying to do is provide information to set you up for success regardless of what happens. So you want to be able to implement a telehealth solution that is going to be easy for you to set up, easy for providers to use, easy for patients to use, easy to move patients quickly from in-person visits to telehealth visits if we see new restrictions in place in certain areas. And like I said, I think what we're looking at is probably peaks and valleys in different areas of the country over the next 6 to 12 months until there's a vaccine that can be reliably rolled out to a lot of people. So ease of use is a big one. Make sure it's something they can show you how to, when you're looking for a solution, they can show you how it works, and it's clearly something that is manageable and easy for staff and patients. Also, is it easy to set up? Is it cloud-based? Cloud-based right now is definitely, I think, the preference because it is a lot easier to implement and turn on, and often is supported with updates and things like that automatically and on a fairly regular basis. And not going to take a huge amount of time to get set up. So when you're trying to roll something out that fast, obviously you want it to be something you can do quickly. And then on the cost front, again, something where you are looking at, say, an all-inclusive fee that includes the software itself, the setup, the training, any ongoing upgrades or support, things like that, right? You don't want to be nickeled and dimed with a bunch of added fees. So ideally, something that is maybe like a per provider fee or something like that. And we've had somebody kind of ask, what is a reasonable fee? I think it depends a little bit on if you're purchasing something that is a standalone versus something that maybe is part of another system. So for example, we have something that is an add-on. If you're already a customer, the pricing is a little bit different for adding something on versus a new customer who maybe is bundling all of that together. So it's hard to say. I think, it's a good idea to think about what your goals are, what you can expect reasonably in terms of an ROI on using telehealth, and then, set a price that you feel comfortable with. or set a, from a budget perspective. I think that's the word I'm looking for. Budget. Set a budget you feel comfortable with. Okay, so support, again, something that includes support and where support is available through a variety of channels. So things like, phone, chat, email. Is there a good kind of knowledge base of articles, videos, information about kind of setup and how you use it? And then, of course, is it secure, HIPAA compliant, high definition? Are there features that support the rest of the workflow? If you're doing virtual visits, you need to have essentially a digital or virtual workflow. So around things like scheduling, reminders, intake forms, bill pay, are you able to kind of do all of that electronically in some kind of workflow that makes sense with the telehealth technology? And then, as I mentioned, HIPAA compliant security is obviously important as well. So is it secure? Does it meet those requirements? And I know that some of you are going to say, well, right now, the government has said that it's okay. It doesn't have to be HIPAA compliant. But the reality is while we may see that the payment structure starts to change for the long term to support more telehealth, it is highly unlikely that we will see a change in HIPAA requirements. It will still, in the long term, require a system that is HIPAA compliant. So if you're looking for something now, for the third of you who haven't implemented anything and are thinking about it now, I would strongly recommend that you look for something that's HIPAA compliant. For those of you who already have something in place, if what you have currently is not compliant, now would be the time to be making the transition and spend some time looking for something that is, so that you can continue to support telehealth in the long term. I think what we are seeing is that patients do like telehealth. There is also some added convenience with telehealth for providers. And we are hearing from many of the practices using our systems that they are planning to probably maintain some amount of telehealth for the long term. Okay. So someone just asked me about HIPAA compliance and signing forms. So part of the relaxation of the rules right now is that while you do need to still get consent from patients to do telehealth, they can do that consent verbally during the visit. So as part of the visit, they can do a consent verbally, and their consent is good for 1 year. Prior to this, you did have to have written consent from someone signing a consent form and keeping that on record for a year. Again, it's every year. So you may want to consider how to work into your process now the appropriate consent form so that you can have that in place and not be worrying about when is it going to switch back to requiring, some kind of actual consent form. And again, you want to be thinking about, do we have a setup that allows us to do that whole process electronically for patients who are not coming into the office? So number 2 in our list of our 5 things is about workflow. So we touched on a couple of these things, just talking about whether or not when you're selecting a system, you'll be able to fit it into a larger workflow that makes sense. But there's more to the workflow than just the visit itself. So the first thing is the appointment scheduling. There is probably nothing more important than having these visits set up correctly from the beginning, both for appointment scheduling and billing purposes. So really critical that when you are deciding to offer telehealth appointments, that those appointments are set up accurately to support both the visit itself and the billing after the visit. Also, you want to be thinking about how you're scheduling those visits. Because so many patients are being rescheduled or being postponed and scheduled again, some offices are feeling very overwhelmed in trying to keep up with the current patients who may already be on the schedule, who they're trying to keep in place, while also trying to schedule, 2 or 3 months worth of patients who may have been postponed. So you may want to think about, are there more efficient ways for you to be able to schedule? Can you offer online scheduling? Can you send out a group email to all your patients who need to reschedule, letting them know that either you'll be reaching out to them or you'll be texting them to coordinate? That's a great option, to text groups of patients and kind of do batches. Just think about how to manage that process of rescheduling so many patients while you're scheduling, new patients, and you've got patients already on the schedule. You may even be offering extended hours to try to fit everyone in. you don't want to totally overwhelm your staff. Okay. How will you remind patients and deliver instructions, right? This is new for a lot of patients. They may not ever have done it before. You need to make sure that you are, that your reminders can contain instructions about what they need to do to participate in that telehealth visit. And you may want to give some of this information multiple times. It may be that you're giving them some basic information when you schedule and saying you'll get some of this again in your reminder. You may want to put some of this information in your intake forms. There's lots of ways you can do that. So how will you pre-screen patients? Can you do that both at the time that they call, make a mention of it in their reminders, like if you're having symptoms, please call us first, things like that. Really think about how can you do most of that in a virtual environment versus an in-person environment. How will you collect payments from patients if they're not actually coming into the office? If you are using best practices and you currently collect co-payments at the time of service, you're going to want to have a process in place for that. And that's probably going to require some kind of electronic bill pay solution. How are you going to track patient experience? Do you currently have some kind of survey process in place to track experience, with a post-visit survey? And have you gotten your staff, up to speed on how to correctly code and bill for these visits? So again, going back to, they need to be set up correctly from the beginning so that when you get to the end, it's easy to, continue the process on and code and bill for those visits. You may need to look into getting some additional training for your billing team to make sure that they've got the expertise they need to do that effectively. As we know, it is one of the main reasons people are hesitant to get involved with telehealth. So to make sure that you can get the most from the implementation process and get the most from using telehealth, because this is new to most people. Very small percentage of practices, especially smaller practices, have ever used telehealth prior to COVID. It really is a lot like, think about it a lot like implementing an EHR, where you want to clearly document and set your goals. Be clear about, what are your intentions? What are you trying to do here? Then really document the workflow. Where does it need to change? Where can it stay the same? Does your staff need to be trained in this new workflow or in new technology to support that? It is critical, just like with an EHR, to engage your staff and get their buy-in. How do they feel about this process? Maybe even give them a chance to demo, different parts of the software, get comfortable with it, make sure that they feel like it meets all their needs. Your front desk staff and assistants often have a better sense of what the challenges might be for your patients. So having them involved in the decision and allowing them to see technology before you buy it and getting their feedback can be really, really helpful in addressing things that you might not think of. And of course, make sure everyone is trained thoroughly. One thing we do know for sure from especially the early days of really trying to get everybody using electronic health records is that there was quite a bit of research on the impact of training during the implementation process, and training directly equated to satisfaction. The more training people got, the more satisfied they were in the long term with their software. So absolutely critical that everybody, has some training, and it can be really helpful to have some kind of super user in your practice who gets the most training, most in-depth training, and is always there to answer questions and help people. Testing your processes internally with your own team. So set up some phony visits and run through the entire process with your staff as a patient, and let your staff run through that process a couple of times to make sure that there's no hiccups and that everything seems to be working. Have some kind of contingency plan. So if suddenly your internet goes down, or a patient's internet goes down, or a provider gets sick, those kinds of things are certainly possible right now during this period. So we want to be sure we're really thinking about what are all the things that could happen that could go wrong in terms of us being able to continue to provide services, and think about what's your backup plan. And one thing to consider, I mentioned earlier this idea of using two-way text messaging to help with scheduling. You can use two-way text messaging to help with other aspects of running kind of a hybrid care type scenario. So if you're seeing patients in person and through telehealth, right? Two-way text messaging is a great tool for the in-person visits because you can do things like a park and text waiting room. It's a great thing for virtual visits because you can use it if someone's having a problem and it's very immediate and they can get help right away. So be thinking about, like, what do you do if someone's having a problem? What information have you provided to them about, how to get in touch with you? Because if they're, say, using their phone to try to do the visit and that's their best device, they may not, it may be easiest for them to just text you from the phone and say, I can't seem to get on, what am I doing wrong? Making sure that you have enough bandwidth to manage. This is a question that has come up quite a bit. Bandwidth is kind of an issue nationwide right now with everybody working from home. So you just want to be sure that your bandwidth is okay. But it's also good to be thinking about what kind of area are you in and what is the bandwidth in your area. I actually live in an area that's somewhat rural. And in the town itself, there are many options with good bandwidth. But outside of the town, the options are limited, and for many people, bandwidth is a real issue. So be thinking about that, and how will you work with patients to make sure you can offer them a way to, maybe it has to be a telephone visit because bandwidth is a problem for them. And finally, before you get started, as you're going through this implementation process, you're going to want to check on your malpractice coverage. Some malpractice insurance companies cover telehealth, some do not. Some require a change in your actual policy and coverage. So just make sure you've looked into that before you move ahead with telehealth so that you can ensure that you're covered. Okay. So some billing considerations. I am going to preface this by saying that I am not a coding and billing expert. We have had some great coding and billing experts come in and provide some content for us. There's some really good stuff on our blog, and we do have a couple of kind of billing tip sheets that you can download. But this information has been changing quite a bit. So, you can also, your coding and billing personnel can also look to your specialty societies. So, like the American Dental Association, American Medical Association, and the coding associations like the AAPC. But there are a couple of things everyone should check on and make sure you have sorted out. One is verifying the licensure at the state level and whether the state allows you to provide telehealth. For some of you, it may also be, are you able to provide telehealth across state lines, depending on kind of where you are and where your patients are and what kind of care you're providing. I ran into that issue. We had been traveling and I needed and it was an extended trip and it was during COVID, and we ended up kind of getting stuck and I needed to get a prescription refilled, and we did run into an issue that we were in California and my doctor is in Montana, and she wanted to do a visit with me to talk about how things were going, but we weren't able to do that because despite the fact that the rules have changed at the federal level, and people can practice to the top of their capability and licensure, California does not allow cross-border telehealth. So you do need to just verify any additional regulations at the state level, which is just regardless of what the current federal scenario is. Again, at the federal level with CMS, patient consent has been loosened. It can be given verbally at the time of service and only once annually. However, some states have slightly differing rules. So you want to make sure, again, that you look into any additional regulatory issues that may come up based on the state that you're in. We also know that some states are not allowing telehealth for dentists while other states are. Those are things that, despite what's happening at a federal level, you need to understand about your specific kind of environment and what's going on. Coding and billing. This is where, again, everyone is really concerned about how they will code and bill for this because it's very new to most people. So we did have one of the top experts, coding and billing experts in the country, come and speak and present for us on what is happening with telehealth coding and billing. She strongly recommended creating a spreadsheet to track the requirements for each of your payers and document all the details. So modifiers, place of service, types of documentation that they want. What are their rules? And you can also document, what, given your contract with them and their rules around telehealth, what are they reimbursing or what are they not reimbursing? Just get as much detail as you can, track it all in a spreadsheet. Now, she also gave some additional information for medical providers in particular. In general, it is that you're going to use the place of service you would normally use and add the modifier for telehealth. She went on to kind of say that's another thing you do want to just make sure you double check with all of your payers, because some of them are asking for slightly different information. So it is possible that it could vary, especially in different specialties like dental or vision. The other thing that she noted and has talked about quite a bit is that in her ongoing conversations with various government and commercial payers, some are saying that they will go back to normal and drop additional coverage for telehealth, while others are saying that they have every intention of continuing as it is right now. She actually gave the specific example of Tennessee Blue Cross Blue Shield, which has publicly declared their intention to continue with the telehealth coverage that they are providing today. I think that we will see over time, quite a number of payers probably say that they will continue. But again, you're going to want to keep going back to payers each time things change and document in detail exactly what they're telling you they want from you and what they're planning as far as coverage goes. So this is going to be sort of an ongoing project, unfortunately, for people who are involved in billing and coding until we are on the other side of this, which could easily be, another 6 to 12 months down the line. The upside, okay, so it feels like a little bit of a downside there because the billing is complicated and is going to require some, tedious monitoring and tracking. So that may feel like a downside. The upside is that patients are actually incredibly comfortable with the use of telehealth. So we touched on this in the beginning, but most patients say they're happy to use telehealth. Most patients say that the majority of the time that virtual experience resolved their concerns just as well as it would have resolved their concerns in person. And everyone seems to agree that really it's all about kind of ongoing communication and preparation. So if you are communicating well with patients about what it is they need to do and how to get help if they need it, and how to use these technologies and make sure they know how to get help if they're having a problem with the technology, that there is a good chance that you can have great telehealth visits with patients, resolve their concerns, and give them a good experience. That said, there are definitely some things we can do to ensure the best possible patient experience. Some of these are workflow related, some of these are more sort of behavior related, some of them are a little more for the patient, some of them are a little more for staff, and some of them are a little more for providers. So we'll kind of go through these, and this is really where you have to work as a team and have great communication internally as well as externally to make sure that you can do this process, whether you're in a period of time where you're offering almost entirely telehealth visits, or you're trying to do something like a hybrid care scenario where certain types of visits are seen virtually and certain types of visits are seen in person. You really want to be able to do it all well, because your ultimate goal is to be able to provide as much care as possible to as many patients as possible, and to retain those patients for the long term, so that when we are through this and on the other side, you still have your patients and you still have your practice and you're thriving moving forward. So when patients call to schedule, you want to be clear about what type of visit it is going to be. And this really should be defined by clear clinical guidelines. So your clinicians need to have established clear guidelines around what qualifies for what type of visit. And you need to also be sure that you are checking with patients to make sure if what you're trying to push really are video, kind of, the synchronous video and audio encounters, that you're not pushing a patient into something that they can't support because they don't have the right device or the bandwidth. So encourage video, but be sure you're saying, like, if that's something you can't do, we can offer you a telephone visit instead. Just be thoughtful about, especially if you're in an area that really does have bandwidth issues, be thoughtful about that. And then explain to the patient, how are they going to participate in this call? Is the provider, if it's telephone, is the provider going to call them, or are they going to call in? If it is, video, how will they get the link, the instructions? Is it going to be through a text or an email ahead of the visit? How do they get help if they can't get on the visit? I will say early on in this process, I had a very frustrating experience where I needed to get my daughter in to see a provider, and I called and they said, we're going to do a quick check-in with the provider first thing tomorrow morning, and then if they want you to come in, we're going to put you into an appointment slot tomorrow. And she said, and the provider will call you at, I think it was 10 a.m. And so I had blocked my work schedule to make sure that I was available at 10 a.m. And at about 10:15, I was like, oh, okay, is this not happening? Like, what is going on? I called the office. I was put on hold. And then finally they came on and I said, it's 10:15. You guys said I was going to have this quick 5-minute check-in at 10. And they said, oh, no, the check-ins are anytime between 10 and 11 and someone will call you. Well, that's a very different message from the message I initially got, which was you will be having a 5 to 10 minute check-in call at 10 a.m. and the provider will call you. You need to be, and so I was very frustrated because I had blocked time. Now I had to go block more time because now it was almost 10:30 and I had not blocked out that next half hour. And the provider didn't call me until I think it was about 10:45. So that's very frustrating for patients. That's not a good experience. You do not want to have that happen. You want to be very clear about exactly what that encounter is going to be, what time it's going to take place, how they're going to participate. In the piece that's about phone calls, you want to go so far as to make sure they know, what number is it coming from, because some people won't pick up the phone. Which actually, and I've had that experience as well. We have a similar scenario at our veterinarian, and we had a pet crisis emergency scenario. And I dropped the dog off, and they said, make sure you answer your phone, even if it says it's restricted, because her number comes up as restricted, and a lot of people haven't been answering the phone, and she's trying to get a hold of you to tell you what's going on with your pet. So, those are the kinds of things people need to know, or somebody might not answer the phone, or they might not dial into the call. Okay, so additional things to discuss and verify. Does the patient need to download an app, or is it just going to be they're going to get a link via email or text and click on it and be right there in the video visit? What kinds of devices can they use? Can they do it through their phone, their tablet, their computer? Again, do they have reliable internet? Again, if it's a phone encounter, how will that take place? Are they calling you? Or are you calling them? What number should they expect to see? Suggest that the patient be prepared in a fairly private and quiet space for that visit, so that other people are not there unless they have someone they need to be there. Which brings us to this accessibility issue and issue of primary care partners. You do also want to double check on anything like language barriers, hearing issues. Do they need to have somebody at the visit with them? All of those things are things you have to address differently today because we're not in the office. People are not coming into the office. We're not addressing these things, during the visit. You probably would need an interpreter to plan ahead for an interpreter anyway, unless you have people in your office who speak the language. But these are bigger issues now than they were when everything was just in person. You don't want to have somebody show up for a video and you're totally unprepared for that. And in many cases, something like an interpreter or a family member or care partner might be someone who's not actually in the same space. So, explaining how that will work, that multiple people can receive that link and come into the visit, or however that works, that's really important. Okay. And then this piece really is for kind of the staff and the provider to prepare and make sure they're doing a good job of interacting in the video visit with patients. Ideally, you want the provider to mostly fill the screen and have the area clear of clutter so that they can really focus. The provider can focus on the patient and the patient can focus on the provider. For the best visual experience for patients, it's best to kind of stick with neutral colors, not having bold patterns or big jewelry or distracting stuff. Always check yourself in the mirror before every visit and make sure you don't have food in your teeth. Check your lighting, close your blinds, try to avoid glare. These are things, again, if you do that process of running through this with your staff a couple of times, kind of an exercise of running through this with your staff a couple of times, I think you're going to find that these are the things that will come up where you'll go, oh, we have a real glare problem in that room with the way we have set that up. Or another one is noise, having microphones, you'll see at the bottom, near a fan or an AC unit or an open window. Those are the kinds of things that sometimes show up when you run that test run and you realize, oh, it's really loud and I can't really hear the provider. However, we're talking about being loud. You don't want to scream and yell at people either. You do want to use your normal voice. So it's best to try to address issues around sound, putting the microphone in the right place, turning off the AC unit, those kinds of things, and just help providers get in the habit of creating the best visual and auditory experience for patients. Okay. So we've gone through all of these really critical things about how to make sure you're set up for success around training, around setting up the visits, around the workflow. And then you really need to be able to track your progress. And we talked about at the very beginning how important it is to have really clear goals about what you're trying to do. We have had practices who have basically ramped up to telehealth for 80 or 90% of their patient visits right now. Well, if you're doing that, obviously you need to be tracking how you're doing in the same way that you track your current metrics around in-person visits. So a lot of these are going to seem like, oh, well, those are the things we already track. That's great. You should just be tracking them and comparing how you're doing in a virtual environment versus maybe an in-person environment. Is your patient retention at the same level? Is your is your revenue at the same level? How are you doing? Right now, video visits and many telephone visits are being reimbursed at the same rate as an in-person visit. So it should be fairly comparable. You may even find if you're billing for check-ins and store and forward and some e-visits as well as telephone and virtual visits, you might find actually you're doing pretty well from an ROI perspective because you're billing for stuff you didn't bill for before. You may have been doing 5-minute check-ins with people to triage people into visits before and not have been billing for them, right? So these are things you want to be watching to see what does that revenue really look like if we're billing for a check-in and then billing at the same rate for say a virtual visit, and if you're able to maybe be doing a hybrid care version of your office where because you need to socially distance patients and space them out a little more, maybe you see a patient in person and then you see a patient or two via telehealth. Is it allowing you to see more patients, right? So we need to understand how all of that is working. So these are some of the things you should be thinking about tracking, right? How many visits overall? How many virtual visits? How many in-person visits? How many overall visits? Are we actually, are we actually able to see as many patients or more patients while still sanitizing successfully and social distancing? What is the number in comparison of, telehealth and virtual visits over, in person? Is that changing over time based on different guidelines and what's happening? Really getting an understanding of what now is your mix of visits. How many are you doing? Is it allowing you to see the same number of people? Are you seeing less people? Are you seeing more people? What is the average duration of these visits versus, your in-person visits? And then on the patient side, we obviously want to be tracking how patients are responding to the experience. How are they engaging with telehealth? How do they feel about it? How's their satisfaction level? And these may be things you track already with post-visit surveys, but just getting an understanding of, patient satisfaction, their willingness to recommend these services. Are you getting some new patients who are maybe coming to you specifically because you're offering these kinds of services? Are your existing patients happy to come back and continue using telehealth? And then it's not a bad idea just to keep an eye on how long does it take to get an appointment? How long are people waiting before they get in for their appointment? What is the overall visit time? And again, be comparing these things between your virtual visits and your in-person visits, just so you have a good sense of, is it better? Is it worse? Is it the same? And are there things you need to address or fix? And it's a really good idea also to be looking at some basic staff and provider metrics. These two slides are very similar. It's really how satisfied are they? Are they getting to take their breaks? Are they working more? Are they working less? Um, and and kind of keeping an eye on what is their experience, because it is a big change to be doing, a whole new way of interacting with people. And if they're having trouble using the technology or they're very unsatisfied, that's not good for them, but it's also not good for patients. And we also don't want to see people feeling, again, like, they're really overburdened and they're working a lot more hours, because this is a very stressful time already. So, even if it weren't that we're trying to track everyone's satisfaction with a new technology, people are struggling right now. A lot of people are working from home, or their kids are not in school or summer camps, and they're trying to someone's at home taking care of kids, and somebody maybe is an essential worker and is going in, and that's stressful for everyone because they're worried about what that means, with somebody going into work all the time. We know that dental offices in particular are one of the high risk areas, but healthcare in general is higher risk. And so people are nervous. So you're not just thinking about how's it going with, in-person versus virtual visits. You also want to be thinking about, how are your staff doing overall, and is there anything they need for additional support to be able to get through these difficult times. And of course, looking at your basic, financial metrics and making comparisons, because ultimately, everything that you offer, should be about patient care, patient satisfaction, provider satisfaction, as well as, your bottom line. And that's, at the end of the day, you still have to be able to pay your bills and keep your doors open. And that does require being savvy about your financial metrics. So, looking at what's your overall reimbursement by visit type and cost by visit type, and, are you seeing more revenue, less revenue, same revenue? That is really important. And you may find, as I said, a lot of practices are finding that actually they're able to see more patients by alternating between in-person and telehealth visits than they would have been if they were just doing in-person. And so you may find when you look at those financial metrics that they're pretty good. And then finally, the service metrics, which is really going back to, did we choose the right solution and is it working? Are we able to effectively complete all our sessions? Are we getting them the messages? Are they accurate with the information they need to participate in these visits? Are people able to get in? Are we seeing kind of a bounce rate on the communications or on the visits themselves? What is the uptime and downtime? Are there service issues or bugs? We're tracking all of those things, because obviously you don't want to stick with a service that isn't working. So, and I would say, given that a lot of people are implementing technology quickly and a lot of companies are upgrading technology quickly, inevitably you're going to run into a problem now and again. And that being the case, the question then is the company working hard to fix that problem? Because there will probably be problems. It's more of is it something that's not getting resolved? We're tracking these issues, and maybe it happened once and the company resolved it and it's fine. But if it keeps coming up and isn't getting resolved, or they haven't made some commitments to get it resolved within a certain period of time, then that can be an issue. So you just want to be keeping an eye on your service metrics. So I have been mentioning throughout this idea of hybrid care. So, many patients say that, yes, in fact, they would be happy to continue using telehealth after COVID-19. We know that we're probably going to be in this peaks and valleys period with COVID-19, where people need to continue sanitizing, social distancing, and trying to protect their staff and their patients for quite some time, maybe 6 months to a year. So hybrid care really is this combination of in-person visits and visits at a distance, and trying to balance that in a way that allows you to see the maximum number of patients while protecting everyone as much as possible. And as we talked about with workflow, it does require you to have a workflow that can support kind of an end-to-end virtual workflow that's good for virtual visits, as well as trying to support some of the things you need to do now in in-person visits. So some of these tools, like a digital intake or an electronic bill pay, can be really helpful for your in-person visits as well. So to try to solve for this and to support practices using Solution Reach, we have actually packaged up all the solutions we think that you need to be able to effectively provide hybrid care. So that's our SR intake, SR telehealth, and SR pay, kind of packaged together at one low price. And then when you combine that with the Solution Reach platform, you really do get a whole end-to-end workflow that can support hybrid care. We have done that given the feedback we have gotten from customers over time. And I do want to just push out another quick poll asking if anybody would like someone to follow up with them about this SR hybrid care package. So I'm gonna launch this out. If you let us know that you want somebody to follow up with this package and pricing and all of that kind of stuff, we'll make sure that somebody does that here in the next couple of days. You obviously don't have to buy the whole package. We've just packaged this up in this way because we found from feedback we've gotten that this is kind of the most effective set of solutions for people. Obviously, if you have some of these solutions in place already, but you're just interested in finding out more about one piece, like maybe the bill pay piece, you'll see when you get to the survey after the webinar, it'll ask you if you want somebody to follow up with you about anything else. You could just say yes there. So I'm going to close this. And then I'd like to ask one more question for those of you who said no, so that we can get a better sense of why this package might not appeal to people. This is just a learning exercise for us. Can you tell us why not? So we have kind of put out some questions here. This is really just to help us understand if you're not interested in a package of services like this, what is the reason, so that we can try to address people's kind of concerns or figure out, where people are in their process a little bit better. Similar to kind of understanding who's using telehealth and who's not. While people are filling that in, I just want to mention, please feel free to throw your questions in. We've got about 10 more minutes, and I am happy to answer questions that people have about using telehealth or about hybrid care. I'm happy to answer questions that are Solution Reach specific or not. Either way is totally fine with me. I'm going to give everybody just 2 or 3 more seconds here, and then I'm going to close this poll. Perfect. Thank you. Thanks for sharing that with us. It really does help us with figuring out how best to create solutions, upgrade solutions, package solutions, and provide the best options and services for our customers or for people who are interested in using Solution Reach. We are just working all the time to try to make ourselves better. So your feedback is super useful and helpful to us. I do want to wrap up before we do questions just to say that in my mind, the main takeaways here at the end of the day are it is all about preparation, communication, and testing. So prepare really well before you launch a new service out to your patients. Communicate that in the best possible way over and over and over again with your staff and your patients. Train, communicate via group messages out to patients that you're going to be offering new services and how they're going to work. Communicate with them when they schedule. Communicate with them in their reminders. Really, the more communication people get, the more education they get about how things work, the smoother it will go. And the test, which is really, test everything with your staff before you roll it out to your patients to make sure that it works. And it really does help you find those little things that maybe need to be fixed. Okay. So here we go. Oh, I did want to mention, for those of you who have signed up for this series, don't forget that we have our last piece next week. We have partnered with My Social Practice to do a webinar specifically about social media right now in this COVID period. They are experts in this, and so if you signed up for that session, we'll look forward to seeing you next week, and I strongly encourage you to be there. Okay. So let's see. We do have some people asking questions. Yay, I love questions. One person is saying, what are you seeing as far as people? So we have telehealth, but we're not really using it. And are you finding that more offices are using telehealth over, in-person visits? So I'm going to preface this by saying, I do think it is a little bit influenced by where you are, right? In some places, there's very little COVID activity, and people are feeling fairly comfortable about, getting out and going to the dentist or the doctor or the eye doctor, while in other places, people are feeling very uncomfortable about that. So I think it's important to think about that. The second piece is I think it's important to ask your patients how they feel about it. So when patients call in for a visit, to say, you know, we're offering the option to do this via telehealth as opposed to in person, and give them the choice, because some people may not tell you that they'd rather do a visit over telehealth, but in fact they would rather do a visit over telehealth. They just don't know it's an option. We've talked to a lot of practices who say that they are using telehealth, even if it's just for, quick follow-ups. So everything from retainer checks for orthodontists to doing, trying to do an initial visit with someone to identify whether or not they need to come in, say, to have a tooth repair or filling or something like that. Same with, vision, same with medical, in terms of doing, say, chronic care kinds of appointments. A lot of people are, especially for high-risk patients. And that's another thing to consider. If you have high-risk patients, you may want to encourage them to do their visits over telehealth, because even if you're in an area that doesn't have a ton of cases, people who are high risk really still should be trying to stay at home and self-quarantine as much as possible. So you may want to, really strongly consider just suggesting to your high-risk patients that visits be done over telehealth if it meets your clinical guidelines. And we've got a follow-up question to that with somebody saying, well, we put it on our website that we're offering telehealth, but nobody's asking for it. So I would say that putting it on your website is not necessarily the most visible in terms of patients being able to see it. Our recommendation is really sending out some kind of mass communication to people saying, here's what's happening in our practice now. Yes, we are reopening, or we are open. We are offering visits both in person and through telehealth. Here are the kinds of visits that can be done through telehealth. You can schedule a visit with us through these whatever methods, phone call, text, online scheduling, and really get the information out to people through some kind of direct message via text or email, as well as posting it to your social media and putting it on your website, and to let people know when they call. Like I said, there are a lot of practices we've been talking to who say getting their visit mix of part telehealth, part in person is allowing them to be able to do all this additional sanitizing and social distancing. So, even if it seems like you could be seeing all your patients in person, think about those other factors, because depending on where you are, you may have some pretty strict, health department regulations you need to meet, and you may not be able to do that by having all your patients come in person. You may need to have some of your visits via telehealth. So, and given that right now a lot of them are being reimbursed at the same rate, you may want to kind of push it a little bit. Say, hey, this visit totally qualifies as for a telehealth visit, and here's how that works. And do you want to do that instead? So just be thinking about all those additional factors around, are you really able to do all that other stuff, all the sanitization and social distancing and everything, if you're not pushing some of those patients to telehealth. Okay. And then we do have a question from somebody asking about like the technology piece, not the telehealth technology, but the hardware technology piece. And this question has come up a lot with people asking, like, am I going to have to invest in a bunch of additional equipment to be able to do telehealth? And generally speaking, right now, no. Most computer cameras, tablets, phones, both on the patient side and the provider side, have cameras today that are pretty good for telehealth. Some people are buying don't have cameras on their main computers, and so they're buying cameras, but those cameras are fairly inexpensive. You don't need to get, big, expensive, fancy cameras for the computers to be able to do that. So it's a pretty small investment in terms of hardware. Okay, so we're down to our last minute. Okay. Oh, somebody is asking about PPE costs. Okay. Okay. So the question was, we were told we could bill for PPE, but the insurance companies aren't actually paying it. How do we know that we'll get paid for these telehealth visits? Okay. So This is the whole reason behind why you need to call each of your payers and have some kind of spreadsheet where you document all of the information about exactly how you need to bill for those visits and document your phone call. Who did you talk to? Who gave you the information? What date did that phone call? All that kind of stuff. This is sort of the reason behind that, so that you can ensure that you can get paid for these visits. I am hearing pretty consistently from people that they are getting paid when things are billed accurately. They're getting paid for those visits right now. And I've had somebody, we have another question from somebody saying, prices have gone up on everything like cameras, PPE. And yes, it is unfortunate that that's the case. I would say kind of balance. You may be able to save some money on PPE too by doing more telehealth visits. So even if you did have to invest in a webcam, think about how much that cost is versus PPE, and think about how many patients you can see, and kind of hash out that sort of cost benefit analysis there too on webcams versus PPE. If you have to buy one webcam, versus and PPE costs have gone up by over 1,000% in the last 3 months. It's a significant cost. You may be able to cut that cost by doing more telehealth visits. So that's worth considering as well. All right, we are at the hour. I think that's the last of our questions. If you do have additional questions, you are always welcome to reach out to us, and we're happy to answer them. As I mentioned, you can reach out to us on social media. You can reach out to us if you're a customer through community@solutionreach.com. If you're not a customer and you want to talk to somebody, you can reach out to us at sales@solutionreach.com. Also, as I mentioned, when you're exiting out of the webinar today, there is a little survey which we'd love for you to fill out. And there's a question there that says, would you like somebody to follow up with you about any of the solutions we offer around telehealth and hybrid care? So you can always say yes there too. All right. So hopefully we'll see you back here next week. I just want to say thank you so much for joining us today. It's been a pleasure to have you, and we look forward to seeing you again for our social media webinar next week and other webinars in the future. And have a great holiday weekend, everyone, which is coming up here in just another day. All right. Bye, everybody.